All right, well, good morning, everyone. Happy Monday. And indeed, this is a very happy Monday, and we're going to tell you why in just a minute. But I want to thank everyone for joining us today. And of course, in addition to Governor Lamont, we have Allison Sesso, President and CEO of Undue Medical Debt, Jennifer Jackson, CEO of Connecticut Hospital Association, and Pat Charmel, CEO of Griffin Hospital. We also have Kurt Barwis, the CEO of Bristol Hospital, and representatives from New Vance Health, Stamford Health, and Yukon Health for this exciting announcement for Connecticut residents. Also want to thank Senator Anwar for joining us today. Thank you so much, Senator, for being here. So here's what we have to announce. In the coming weeks, 23,000 Connecticut residents who have medical debt will be notified that some or all of their medical debt has been eliminated under our first round of major medical debt forgiveness. In our state budget, we have dedicated $6.5 million in federal funds to partner with Undue Medical Debt that buys medical debt for pennies on a dollar, and it wipes medical debt out for residents. So in this first round, our state spent only $100,000 of that $6.5 million fund, and we have successfully canceled out $30 million in debt. So I'm just going to say that again because that's pretty exciting. We've spent $100,000 in federal funding, and we have canceled out $30 million in debt for residents of Connecticut. So even better news, you're thinking, okay, if we're going to cancel $30 million in debt, that it's going to take a lot of paperwork. But the second really good piece of news is residents do not have to apply for having their medical debt to be eliminated. If they are included in this first round of debt relief, they will receive a letter in the mail from Undue Medical Debt. Those letters are going out on December 23rd, and those letters look like this. Residents have and should be rightly skeptical about scams, but we want to show people what this letter is going to look like. And if you are one of the 23,000 people that are receiving this, it is not a scam. It's really good news, and it's an early Christmas or holiday gift to you. And it means that once you receive this letter, that your debt is eliminated. You don't have to do anything except keep the letter. So this can be life-changing for so many Connecticut residents who are already burdened by medical debt and, of course, challenges in the housing and grocery and fuel departments. But this is really, really good news. Medical debt is the #1 reason why people go into bankruptcy. So this is why this announcement is so very exciting. So we're looking forward to further rounds of medical debt forgiveness and elimination because I would like to stress that we've only spent $100,000 of the $6.5 million that has been dedicated by the legislature for this important program. We believe in Connecticut that if you get an illness or you are involved in an accident, you should get the health care that you need, and you should not be burdened with debt as a result of that accident or illness for a long period of time. So with that, it is my great pleasure to bring up Allison Sesso, who is the president and CEO of Undue Medical Debt. Allison.
Thank you so much. I am so happy to be here and to be bringing our interesting and unique model, which I'm sure you all have lots of questions about. How do we get such a good return on investment? But I'm so happy to be here with great partners, with the state of Connecticut, with the Hospital Association, and so many of the hospitals we've been talking to, and that's how we're going to be spending the rest of that money, by the way. We're going to be working directly with the hospitals here in the state to get rid of those medical debts. So I'll start with how it works. It is not magic. It is the market. Basically, there is a for-profit debt market in which you can buy medical debt for pennies on the dollar, and the reason why you can buy it for pennies on the dollar is, unfortunately, the people who owe it really don't have the money to pay it. See, our healthcare system has unreasonable expectations on what people pay out of pocket based on their income. And as a result of that, you see lots and lots of medical debt to the tune of $220 billion in the United States, and it impacts 100 million people. So it's a pretty significant, large problem. What we do is we buy those debts for pennies on the dollar, just like a for-profit debt buyer would do. But we leverage government and donated dollars to do that. We have a debt engine that we actually created with a team of engineers. It's one of a kind. It takes those thousands and thousands of accounts, analyzes them, identifies people that qualify, and there is no application process, very important as you mentioned. And the reason why there's no application process is because we pre-qualify people. We actually get by income data, and we find everyone that is 400% of poverty and below, and so in real terms that's about $120,000 for a family of four. Or if the debt is 5% or more of the person's income. And then we letter everybody up and let them know that their debt has been relieved. People tend to have, some disbelief when they get these letters. I didn't do anything, how did I get this? But then when they realize it's real, they usually have tears of joy and happiness and a real sense of relief. And the beautiful part about what we do and after that is we get those letters back from people that tell us, because we really encourage people to share their stories. Because one of the things we're trying to do is break the stigma of medical debt, because it's really a failure of the systems and not of people. People want to pay their debts, they just don't have the means to do so. So we really go out of our way to make sure that we tell the stories of the individuals who have had their debts relieved and share those in a meaningful way, because we do want to see greater solutions. We recognize that what we do at Undue Medical Debt is really meaningful, but it's not the ultimate solution to this problem of medical debt that we collectively have. It's a failure of systems. Hospitals do a really great job, and here in Connecticut they're doing a great job at their financial assistance policies, making sure that they're giving free and discounted care and make sure people can access that. There's always more work to be done on that front, of course. But it matters what people walk in the door with to begin with. And what we're finding is increasingly people walk in the door of those hospitals underinsured. They don't have enough money to pay the deductibles that are expected of them. They end up out of network through no fault of their own. And they end up in a situation where they're in medical debt, they're dealing with a horrible situation. It could be an accident, an illness, or something that happened to them that really undermines their ability to move forward and to pay that debt. And so we have to really look at both the financial assistance policy plans as well as the insurance plans together to really solve this problem fundamentally. And one more thing I want to commend the governor for, and for the legislature as well, is passing a law that actually gets ahead of the consumer problem, which actually bans having medical debts on credit reports. That is a great pairing with this program, and you guys should be commended for doing all this great work in the state. So thank you for the opportunity.
Absolutely. Allison, thank you so much. And now it's my pleasure to bring up together Jennifer Jackson. She's the CEO of the Connecticut Hospital Association, and Pat Sharmell, CEO of Griffin Hospital, for a few words.
Good morning, and thank you, Governor, so much for including us in this important conversation. No one should avoid or delay seeking needed medical care because of a concern about inability to pay. That's a core value of Connecticut hospitals. We provide high-quality care to anyone who walks through our doors, regardless of their ability to pay. Connecticut is a leader in providing financial assistance through hospitals. The hospitals in this state have some of the most generous financial assistance policies in the nation, and they work very hard to make sure that patients and their families know about those policies, and they also work diligently to connect patients with insurance that may be available. We also believe very strongly that medical debt should never limit an individual's economic opportunity. We are opposed to aggressive collection practices and do not engage in them. And as Allison talked about, we have long refused to report medical debt to consumer agencies, and we were very happy to support the bill that the governor proposed to codify this practice. This program that Allison described is another tool, and we look forward to continuing to partner with Undue Debt, with the state, and with other partners. But there's more that we need to do to prevent medical debt in the first place. Among those, we need to continue to expand coverage, as the governor and the legislature have been very focused on doing. And there's a lot that we need to do to encourage different benefit design programs so that patients and their families are not faced with excessive costs and high deductibles that they can't afford. We also look forward to partnering on those efforts, and I'd like to turn it over to Pat to talk a little more about what that might look like.
Thank you, Jennifer. Let me start by letting you know how pleased I am, Griffin Hospital and all Connecticut hospitals are, to participate in this effort to erase medical debt for thousands of Connecticut residents through this innovative partnership between the state and Undue Medical Debt. Using some state dollars that came from the federal government, Connecticut, working with Undue Medical Debt, is going to be able to leverage that small investment. For every dollar invested, more than $100 of debt relief. And why is that important? Right now, nearly 1 in 5 Americans has medical debt in collection. This alarming statistic represents real people making impossible choices. Parents choosing between filling prescriptions and buying groceries. Seniors foregoing follow-up care because they have unpaid copays. Young people avoiding primary and preventive care because they can't afford their deductible. The consequences are devastating. Research shows that 64% of Americans with medical debt have postponed or skipped necessary medical treatment due to cost concerns. This creates a vicious cycle. Delayed care leads to more serious conditions, requiring more expensive treatment, resulting in more medical debt. While Undue Medical Debt's heroic effort to relieve consumers of the crushing burden of medical debt should be supported and celebrated, insurers, employers that provide employee health insurance coverage, healthcare providers like hospitals, and policymakers need to work together to reverse the trend of increasing out-of-pocket responsibility for care received, which has grown to the point that it's unaffordable for a large segment of the population. This includes the out-of-pocket cost for medications, which is impacted by layers of expense added to the cost of producing medications for activity that adds really very little value. As the findings of Data Haven's recent survey show, 40% of adults in our state I intended to be a disruptor this morning, but not this. Yes,
Data Haven, yes. Thank you, Lieutenant Governor. As the findings of Data Haven's recent survey show, 40% of adults in our state are struggling to make ends meet. And the most recent ALICE survey reported that just under 40% of households don't earn enough to meet their basic living needs, which includes growing out-of-pocket expense for health care. The Office of the State Controller, the Office of Health Strategy, pioneering health insurers, and innovative employee health plan sponsors have been strong advocates of and have adopted value-based insurance design. The design restructures coverage to reduce or eliminate out-of-pocket costs for high-value services, treatments proven to prevent expensive complications and improve health outcomes. For example, diabetic patients who have zero cost sharing for preventive and maintenance medications, helping them avoid costly emergencies and hospitalization. Similarly, preventive care and lifestyle changes have to be incentivized, and insurance plans must include coverage for evidence-based wellness programs, nutrition counseling, and effective chronic disease management programs. Investments in prevention will reduce the need for expensive acute care, and that often leads to medical debt. Finally, we need to work together to address the social drivers of health. This means expanding programs that tackle food insecurity, housing instability, and transportation barriers, factors that significantly impact health outcomes and healthcare costs. Research shows that every dollar invested in addressing these social factors saves $3 of medical costs. We look forward to working with the Governor, the Office of Healthcare Strategy, the Controller's Office, employers, insurers, to address this larger problem. There are fixes available, but it will take everybody who's contributing to the current system to be part of the solution, and we look forward to those efforts. Thank you.
So this announcement is really directed at equity, because the people who will be benefiting are those families and individuals who are most vulnerable, and it's also part of our administration's efforts to try to make our state more affordable when it comes to housing, health care, and so much more. And with that, it's my pleasure to introduce our fearless leader, Governor Ned Lamont.
Well, thank you, Susan. This is, as Pat, pointed out so well, this is all about making sure that health care is more broadly available and accessible and affordable. And we want to make sure that nobody is discouraged from getting the checkup they need, the preventive care they need, and they're making sure that the hospitals, our amazing hospitals here in the state, can take care of you. And that's what undue medical debt is. It's another way of saying no longer due a medical debt. And I'll just say, debt is an incredible lodestone in life. I know what it means to the state of Connecticut, the heavy debts that we have. I can tell you what it means for a family at the starting line of life. And heavy debt can just be cement over shoes as you're trying to put on your track shoes and start running. There's a lot of different types of debt. Obviously there's credit card debt out there, but try to do everything you can to make sure to get those onerous fees off of there, but that's probably something that's your responsibility. There's a lot of student debt out there, and that's something you invested in for a better future, but that heavy debt can really slow you down in life if we don't make some relief there. So that's why, working with our friends in the legislature, we're giving them incentives for our companies to pay down your student debt and to make it a little easier for you to get started in life. Medical debt, I think, is different. Medical debt is something that you don't necessarily have any control over. Medical debt is when you get hit hard by some sudden medical emergency. And all of a sudden you find out that the anesthesiologist is not in network or a high deductible, and we're doing everything we can to make sure that this is an emergency that you can live through and that you can make sure that you're taken care of. and making sure that when you come out of the hospital, you don't have another burden on your shoulders. And that's what undue medical debt is all about. And look, right now it's only $100,000, which got us $30 million of relief. Everybody says that's pennies on the dollar. If I do the math in my head, it sounds like it's 1/3 of a penny on the dollar. And let me tell you what that means. As you heard Allison say, get that off of your credit history. Make it a little easier for you to rent that home or be able to, buy a car. Those are the type of things that clean up your record and make it easier for you to get about your life in a more affordable way. And I just want to say, Allison, thank you for what you're doing here and working with Saud and our friends and legislators, how we can continue to build upon this. And we're going to roll this out, working with all of our hospitals who are represented, here today. And from this meeting, we're going to be sitting down, a few of us, and talking about how else we can tackle the high cost of health care in this state. But this is a very good start. It is helping thousands of people. And once this is put in place, if it's $6.5 million and 300 to 1 on the dollar, how much help is that for people? A lot. Thank you.
And we also want to thank Connecticut Health Equity for joining us as well. We appreciate you as well. So with that, we thank all of our media partners for coming, and all of these fabulous experts will take any questions that you might have.
I was wondering if Allison Sasso could tell us how much debt has cumulatively been wiped out through donations from municipal and state governments.
Yeah, so we've collectively the organization, which has been around since 2014, has gotten rid of $15 billion of medical debt for almost 10 million people. We have been working across the country relatively newly with places like Connecticut. We're working in New Jersey, we're in LA and Arizona and all these other places. And we will be wiping out a lot more debt through those dollars. I don't think I have an exact figure to date because it's rolling constantly. Like there's literally announcements being made today across the country and other places. So, but all told, we've done $15 billion of medical debt since our existence in 2014, with most of that in most recent years.
One of the questions that the House Minority Leader had when this was created was, would agencies that had purchased these debts for pennies on the dollar, would they be allowed to benefit from this program, or would it be strictly consumers that their debts would be intercepted, as it will, before those credit agencies had purchased them for pennies on the dollar?
So you're asking about like the debt buyers?
Yes.
Yeah. So we buy debt from all sources. We buy it from debt buyers who have already bought it from hospitals, as well as directly from hospitals and from other healthcare providers. So it's all of the above, I guess, is the answer.
So do you have any sense as to, as far as proportion, how much of it is prior to these debt buyers?
So not all hospitals sell their debt. In fact, the majority do not sell their debt. So that's why we like to work directly with the hospitals, right? So I think it really depends. I think the good news is in Connecticut, there's not really a lot of debt selling, which is great, and why it's so important that we're working directly with the hospital association.
Why does someone not want to sell their debt?
Why would a hospital not want to sell their debt? Well, I think the hospital should probably answer that themselves, but at the end of the day, I think that they recognize that medical debts are not the fault of the individual, and it leaves the collection approaches out of their hands. And I think hospitals are very cognizant of what is done to collect things from people who are low income.
We can hear from the hospital association directly.
Yes, Allison said it. As I mentioned, we are very opposed to aggressive collection efforts. We do make collection efforts. We're required to by the federal government and by our contracts with the insurers. But after we've exhausted the ability to help folks either by connecting them with insurance or through our financial assistance policies, we don't sell that debt because exactly of their aggressive collection practices. And I also just want to clarify, we do not report hospital debt to credit agencies.
Are there any numbers available as to how much revenue has gone directly to hospitals to retire consumer debt versus revenue that's gone to, again, these debt buyers?
The cost to hospitals of charity care and bad debt is about $300 million a year. That's the cost to them. $1 million a year.
Okay, and how much revenue have the hospitals recovered? It's obviously pennies, as everyone said, pennies on the dollar. But do you have any idea of what hospitals have recovered as a result of this program?
The program's not in place yet, and this is debt that we're not pursuing recovery. Yes.
Is this something that other states are doing that you're aware of? I also want to take that one.
Yeah, this is, we're working in over 20 places across the local and state governments. So like I said earlier, the state of New Jersey we're working in, the state of Arizona, the state of Illinois. We're also started actually in Cook County, which is where Chicago is. We're about to launch a program in New York City, New Orleans, Michigan. So we're in 20 different places, and lots of places in Ohio, for example. So yeah, we're in a lot of different locations.
People who are in debt, and they could have insurance, don't have insurance, it's a whole wide array of people.
Yeah, I think just in general, increasingly what we're seeing is people are insured. It's an underinsurance, this issue of medical debt, and I want to be clear about that. People have insurance. We did a great job, I think, collectively with the ACA in terms of getting people to be insured, but they're walking through the doors with the plans that have deductibles that are way too high for their actual income, and that I think is the problem. And the reality is people can't actually afford the premiums of the plans that have better coverage. So the hospitals are left holding the bag along with the patients.
You guys have said that typically the rule of thumb is that $1 of cancellation cancels $100 of debt. As the governor alluded to, it seems like in this case $1 canceled $300. So why was this a particularly good deal, and can we expect that to continue, or is it going to come back to the meat?
Yeah, I think, so until we look at the files, we don't know for sure, but in general, I would say, we say 100 to 1 because we can, that's actually, usually it's cheaper. So what we've experienced here is it is usually cheaper. It's usually because of the age of the debt, so for $1 to 100, it means that the debt is like less than a year old. A lot of these debts tend to be, 4 years old, 3 years old. It takes time, and the first grouping of debt usually tends to be a little bit older because you're kind of cleaning up past, so there's a lot more in there. As you work, go on a forward flow basis, the debts tend to be more expensive. So we always want to lead with the 100 to 1 and then sort of over deliver, because when we start to get to younger debts over and over again, it does get closer to that pricing.
Still $6.4 million in this fund. What is the timeline for that cancellation, and do you anticipate that all of that will be spent, or are you going to run out of debt eventually?
We'll see. Well, as we said, the program's really launching. I think it's plenty of money, and we anticipate getting rid of $650 million at least of debt using those funds. But we will see how it rolls out, and it's over the next couple of years. It's a multi-year investment of time that it takes time to do the analysis and to get the letters out and all of that.
Can you talk about a big picture issue, and that is, that you mentioned that debt is the number one reason for bankruptcy, and what we're seeing across this country right now is a breaking point with healthcare, and people are very unhappy and are taking their anger out on others. This may wipe out debt for some people, but it doesn't really address the big picture, and that is why people are getting into this in the first place and how expensive healthcare is.
Do you want me to answer it? Yeah, I mean, I think at the end of the day,
And Senator Anwar,
yeah.
go ahead.
Okay, so I mean, at the end of the day, as an organization, we wish we didn't exist, and we want to end medical debt. That is our mission. We actually have a team of policy experts that are thinking about bigger solutions. We want to be pragmatic. The politics have to follow the solutions, but we do think we can do better. As I mentioned, I think we can think about the insurance people walk in the door with. We can have more subsidies for people. We should think about employer insurance and financial assistance policies. So there's a range of things I think that can be done in present day reality. But yes, I do think that there is a breaking point, and that we do have to recognize that people need to have access to care, full stop.
And I'll just add before Senator Anwar speaks, the Affordable Care Act in our state is currently helping more than 100,000 people who wouldn't otherwise have insurance. And we want to make sure that we keep this going, particularly given what might happen in Washington. And I'll let Senator Anwar talk about legislative efforts.
Sure. Thank you so much for this question. This is probably a $1 trillion question at the national level, if not more. The reality is, in our legislative session this year, we started to look at what are the various things we can do. In this upcoming session, we will be discussing some of these aspects, which include every different aspect. We are going to be looking at what is insurance companies doing, what are they doing that is increasing the cost to the consumer. Another component is how can we prevent this? And it's very preventable. And during this 2024 session, we had very robust conversation with Connecticut Hospital Association. They were partners in this effort. Because of the short session, we weren't able to complete the bill, but we are hoping that we'll be able to have a prevention strategy to reduce that, at least in Connecticut. And also the pharmacy benefit managers, there's a cost of pharmacy, there's a cost of healthcare, there's a cost of insurance. And all of these things would have to be tackled, and we will be having frank conversations during this session about these. So thank you.
Solutions like insurance and pharmacy prices, but hospital prices are very high in Connecticut. In Bridgeport and New Haven, they're 40+% above the national median, whereas Boston is only 9% above the national median. I just wonder what are, and that's from an OHS report, what are the solutions to hospital prices that the administration, legislators, and the hospitals themselves can actually get behind?
I think the governor mentioned at the end of his remarks, and very glad to hear it and look forward to a partnership with him and with the legislature around looking at that very issue. One of the significant issues that we have in this state that shows you the differences, for instance, in Massachusetts, is a significant underpayment by governmental payers. So we have been in conversations with the administration, with the legislature about how we can address that, because that puts, when there's a significant underpayment, Medicaid is 62 cents on the dollar of costs, not charge of what it costs the hospital to provide the care. Medicare is 74. So when we have that significant underpayment from governmental payers, it puts pressure on commercial prices, and employers and individuals end up paying for that. So we are all committed to addressing the underlying problem, both in terms of the current payment level, but also some of the things that Pat Charmel talked about that can actually be part of a Medicaid redesign, where Connecticut can once again be a leader in addressing the conditions upstream that cause the need for expensive care.
Susan was saying about the public anger toward the healthcare system right now. There may be some people who have qualms about the fact that there's even a market for medical debt in the first place. Why are people buying and selling other people's medical debt? I wonder if you could just comment on that public anger and frustration.
I think we're trying to address that through this initiative, which is really one of the first statewide in the country. But doesn't get to your underlying question. I think people are frustrated by the complexity of the healthcare system, what's in network, what's out of network. Nobody's quite sure what it's going to cost you when you come out. Sometimes there's surprise billing. Sometimes things aren't covered that you thought were going to be covered. I can share that frustration, and we're working on that every day. And as Jennifer said, we'll be sitting down talking about it in about 5 minutes.
They pay high premiums. They get letters that often say, well, we're only going to cover this and we're not going to cover that. And so is this a Band-Aid or no?
I can try to address the first question and incorporate this as well. The reality is people are very frustrated because they're not able to get the care, they're not able to get the tests, they're not able to get the medications, and this is because of a number of bureaucratic processes that have been created by the insurance industry. And then that's part of what we saw in the recent past with the reaction that we recently all were shocked to observe. Now, having said that, in the state of Connecticut, every year we are putting in legislations to try and address this. The challenge we have is that the insurances in the state of Connecticut are very few that we have an influence over. Majority of them, 75% or more, perhaps are actually going to be controlled by the federal government. And that's where we feel that the federal government has a bigger role to address these, for a lack of a better word, abuses by the insurance industry. And that's what maybe a conversation we need to have. But in the state of Connecticut, if you look at the bills that we are proposing, they're looking at how we can make sure that they're consumer protective bills. So we will continue that effort.
Is the insurance industry part of this collaboration? Have there been negotiations and talks with them, or they're just not a part of it?
Well,
I talk to them all the time.
yeah, yeah.
Governor, do you suggest that you and Mr. Jackson will be discussing increasing the state's Medicaid reimbursement rates, some of which haven't been touched, I think, since 2008?
As it's part of a much bigger puzzle when it comes to healthcare. So we'll be talking, all the above. And Sue, when you said it's a Band-Aid, remember undue medical debt is 23,000 Band-Aids. And when Allison's done, it'll be 650,000 Band-Aids. But a Band-Aid is not the solution to this problem.
Is that the total figure that you hope to wipe out, 650,000? I'm sorry, I missed that.
$6.5 million, 100 to 1, just
He's
something
doing
like
the
that.
math. Allison, do you know how many, she's looking it up.
Reimbursement rates. We know part 2 of that study is coming out in January. In previous sessions, you've said you've been waiting for that study to make significant increases. So is that something we can expect for your administration to support this study?
Yeah, we did this independent study. We're getting some preliminary information now. We'll have it all out, as you point out, in January. And if we find there's some areas, especially when it comes to preventive care and some of the specialists that are way underpaid and they're denying people access, that's something we're going to take a good hard look at in terms of truing them up.
Well, Governor, that invites the question that we pose periodically to you, which is the state's ability under the current volatility cap and other caps to raise those rates if indeed the studies show, which I think Ms. Jackson would say you don't really need a big study to determine how hard it is for somebody on Medicaid to get a specialist. So what's your latest thinking on whether or not there must be some revisions to those caps to address this issue?
Look, we're going to do the state of the state in about a month. Then we'll do the budget address in about 2 months. But as you know, Paz, I'm not somebody who believes the answer to everything is more subsidies from the taxpayers. Hearing no further questions.
Thank you.
Oh.
All right, any more on topic? All right, good. Thank you.